When should you get the TB vaccine? The tuberculosis vaccine, known as Bacillus-Calmette-Guerin or BCG, is an important tool in preventing tuberculosis, especially in certain high-risk groups. It is not a one-size-fits-all solution. So, when should you consider getting vaccinated? First, let's talk about children. If a child has a negative tuberculin skin test but is continually exposed to adults with active tuberculosis, the BCG vaccine may be recommended. This is particularly true if those adults are not effectively treated or if the child cannot be separated from them. It also applies to children exposed to drug-resistant strains of tuberculosis. Next, we have healthcare workers. If you work in a healthcare setting where there is a high risk of being exposed to drug-resistant tuberculosis, getting vaccinated might be a good idea. This is especially the case if there is ongoing transmission despite infection control measures. However, it is essential to discuss the risks and benefits with a healthcare professional before making this decision. In countries like the United States, where tuberculosis rates are low, routine vaccination is not typically recommended. This is due to the variable effectiveness of the vaccine against pulmonary tuberculosis in adults and the potential for the vaccine to interfere with tuberculin skin test results. There are also some important contraindications to consider. Individuals who are immunosuppressed, such as those living with HIV or those who are candidates for organ transplants, should not receive the vaccine. Pregnant women are also advised against getting vaccinated. The vaccine can pose risks for those with severe immune deficiencies. Before receiving the BCG vaccine, it is crucial to confirm that the individual has a negative tuberculin skin test. The vaccine is only recommended for those without prior tuberculosis infection. After vaccination, interpreting tuberculin skin tests can become challenging due to the sensitivity caused by the vaccine. In summary, the BCG vaccine is selectively given to children and certain high-risk adults who cannot be protected by other means. Decisions about vaccination should always be made in consultation with healthcare professionals who can assess individual risks. This careful approach aligns with public health guidelines aimed at controlling tuberculosis and protecting vulnerable populations. Always consult a healthcare provider for personalized advice regarding vaccination and tuberculosis prevention.